Well, thanks again so much, Monica, for agreeing to meet with me. To start off, could you maybe describe a little bit about yourself and the organization that you work for, Casa Teatro?
Okay, yeah, sure. My name is Monica Sanchez. I'm the artistic director of Casa Teatro Bilingual Theater Group. We are the first, well, the only bilingual theater group in Tennessee. Our mission is to build a bridge between cultures. And we do it this through the arts, to the scenic arts, and also we do a couple of events like the Latin Fest, the Day of the Dead, and the most important thing is educate the people about the Latino culture. Let them know that we are more than what they already know. A lot of people think that Latinos are just the people who come and work and do your yard work, or maybe it's the housekeeper. We're more than that. We have a beautiful culture that we want to share. We always say, the more you know about your neighbor, the stronger the community will be. So let's learn about each other. That's what we want to do. That's what we try to do. And because we're bilingual, we try to people understand that that's important. All our plays are in both English and Spanish. We have somebody who says something in English and somebody answers in Espanol. So we have that connection. And we've been doing this for 10 years. We're a 501c3 organization. And we try to also educate our community, the Hispanic community, in one way or another, because many people say, well, this person is doing this wrong, this people is not doing right, because they don't know. Let's teach them how to do it. And that way they say, así es como se tenía que hacer. That's the way we have to do it. So it's a learning process on everything. And using the arts helps. It's not like somebody's coming and teach you. No, that's not the way. It's see this representation, see this video, and you will understand why you have to do it in that way. So that's mainly what we do here. We try to be most than anything the connection, the bridge between the Hispanic community and the American community. So we can find each other in one place and learn about each other. That's the most important thing.
Me parece. And yeah, I definitely think understanding that dynamic's really important. I grew up in Texas, so for me, that was sort of definitely a part of how I grew up. Hearing Spanish a lot and learning a little bit about different cultures. So
yeah, but we have a lot of people who say, oh, I took Spanish in high school, but it's been so long. Say, well, come and volunteer with us, and you will get it back. You will see how it is, see how que fácil it will be back to you, all those words that you learn. Because if you don't use it, you lose it. That's the reality in anything. If you stop using a skill that you had at one point, it's gonna be kind of rusty and hard, but you will get it back as soon as you start practicing. La práctica es lo mejor que puedes hacer.
Claro que sí. So my next question is, what do you think are some of the most pressing healthcare related issues that are facing the community that you interact with the most?
I think with my community, sometimes is to find the right person. It's hard sometimes for my community to trust somebody. And I don't mean just in the medical field. It can be in any other field. Why? Because when you go to the doctor, you have to fill all these forms with your information. There's some people who might say, why they need to know my husband's name, why they need to know their phone number. And I think that's human nature to be kind of scared. But with some of my people, you might understand that maybe they're afraid for certain reasons. They don't want to provide too much information. And sometimes they don't have all that information they ask you. So when you go to the doctor, they have the need to be seen. And a good percent of people doesn't have insurance, so they pay self, but they still have to fill this form. And something that helps, and I've seen it because my other job helped me to go close to uh, medical providers and things like that, is when they have somebody who speaks their language and can explain them. This is the reason I need this information because this. And sometimes when they go to a doctor who might don't have they have the language barrier, is sometimes like should I trust him? I don't mean that all the doctors need to speak, but I'm just trying to explain this, that helps. When they go or when they make the call to the doctor office and somebody say, un momento, aquí hablan español, and they pass the phone to a lady who speaks Spanish and they can talk, that make them feel better. We have a lot of people, a good number of people who already speak English, but still we have a large population. They prefer. Well, let me tell you, sometimes I prefer to speak with somebody in Spanish when I make calls for anything. And it really feels good when somebody speaks Spanish. Now, here's one thing. People say, well, español es español. Everybody speaks Spanish. Well, it's a little different. People how speak in Mexico, people how speak in Colombia, how people speak in Venezuela. So the people who work in the medical field, they have to be aware that there are a couple of words that maybe somebody don't understand and somebody is not that familiar. And I know there is a program for people who wants to be translators in the medical field, and they have to learn all those things. And sometimes the people don't know the one word for me from Mexico is okay, but another word for a person of Puerto Rico or from Colombia is they're not familiar or is totally wrong. It's something else. So that's the only thing. I believe it's always good with when somebody has somebody in the staff who speak their language. You're lucky if you have a doctor who speaks the language. That is a great point, but that doesn't mean that everybody has to speak the language. I think for Latinos who just got here, make them feel welcome, make them feel like you're not just a number, you're a person that we care, and we have somebody here who's gonna help you with your needs.
Yeah, I definitely can understand that sentiment. And just so you know, there's a student group at the University of Tennessee that does a Spanish-speaking clinic on Tuesday nights at 6 p.m. It's at the Christ Community location on Broad, and we speak Spanish. So, and it's free. So anyway,
oh, excellent.
Yeah, we definitely get people like, I know that people know about it, but it's not advertised very well. So anyway, just thought I would share.
Yeah, well, you have to send us that information because sometimes after the pandemic, a lot of people was in a really bad situation, and they still the healthcare and I mean bad situation money wise. They don't have the money, but they still need the care. So know these places to say, well, there's this location where you can go and you can be seen and don't worry about the money at that moment. So just they will take care of you. So share that information with us. Let us know. So we share it with the people.
Yeah, I actually just recently shared it with Latino Memphis as well. So it should be on their like list of references soon. But anyway, just wanted to. So my next question is, what do the terms health equity and health justice mean to you?
Okay, equally, it will be like everybody has the chance to be seen by a doctor, whatever the need it is. I think that is something that it doesn't happen for many reasons. Sometimes it's sad to say this because of money. sometimes, or insurance, or just because I don't know. It's just that it doesn't happen. But I think I think the many people who comes from the Latin American countries, like for example from Mexico, we know we can go to the doctor and be seen that day and take care of that day. He's different. He is like, even if you're really sick, you have to make an appointment with some doctors. You can go maybe to the emergency room, but it's not the same. A lot of people don't have the chance to have a follow-up because they don't have a doctor after they seen it, they've been seen at the ER. So the thing is that we have also to educate the people that you need to have a doctor even when you don't see it, a family doctor. And not everybody has it. Not everybody has the chance to have a doctor. They can go back at least once a year and have a physical. I see some women that usually that's what happens when they need to have their yearly checkup. Sometimes they don't have a doctor, or there are small campaigns for women to can have the mammograms, but who's gonna check those results? They don't have a doctor. They tell them, yeah, you're fine, but if something is wrong, who's gonna follow that person? So I think even in the American community, there's not an equality uh, in the health issue. And what's the other word? Perdona, pero es que a veces las palabras se me olvidan.
La primera era health equity, y la segunda es health justice.
Health justice. Okay, health justice. Let me put you an example. There's a lot of people in my community that sometimes need a kidney transplant. They need dialysis. They need a couple of things that they don't qualify. So there's no justice. For me, that's the part that I will use, because they're dying, and because of their situation, their situations, they don't qualify. They don't qualify for that, so there's no justice there. So there's a lot of people who sometimes rely on organizations like Latino Memphis to see they can help them making GoFundMe. Well, those things that when you found money,
Yeah.
then you get money from Facebook, and help them to do dialysis, to maybe search for a person who can provide a kidney. I don't know. So there's not much justice sometimes in the part with the Hispanic community in a couple of things, because more than anything, a lot of people don't qualify for that kind of services or needs.
Yeah, very true. What do you think would be necessary to achieve health justice in Memphis specifically?
This is gonna be hard. You're gonna enter in a political situations. If you're open to provide service to everybody, and I mean everybody, I mean everybody. A lot of people are gonna say, great, this is wonderful, we're going for the right way, but a lot of people is gonna get mad. Why this person is using the service? Why this person doesn't deserve to be safe, or go back to your country and get the service over there? So it's kind of hard. It's not just to say, yeah, if we do this, everything is gonna be fine and dandy. No, doesn't work that way. It's a hard thing to do. And I understand sometimes many things doesn't work the way we like it, even when we the doctors or the medical providers try to do it the right way. There's a lot of things back there that doesn't help. There are a lot of things that they say, why this person doesn't deserve that. This person doesn't have the right to have dialysis or to have a kidney transplant. My son is an American, he's supposed to have it, or things like that. I'm sorry if I say it like this. I'm sorry, but that's the truth. So it's kind of hard. And one of the things, let me tell you, it surprised me a lot of people when we come here were really surprised that, in our countries, you get the chance to have medical care and things like that. And here is so hard and expensive. It's just amazing. Uh, People in my country can get their insulins and live for a long time. Here, you have to have a second job to pay for your insulin because it's so expensive. If you don't have insurance, you can 1 month be without the insulin, and you can even die because it's not that easy. So that's one of the things that we're really kind of surprised. This is a wonderful country, but the health system is really, really expensive. The service is sometimes out of your reach. And we have wonderful clinics like Price Community or Church Health Center. They try to provide a service with a reasonable price for the people in low incomes, but they're so full. It takes sometimes a lot of time to get an appointment. I'm not gonna tell you which one of these two I tried to make an appointment, and I got an email saying, you are in a waiting list. It will take about 10 months to get back to you for your appointment. In 10 months, if I was really ill, I might not be here. So many times they say, just be a walk-in. Yeah, it's just spend hours as a walk-in trying to be seen. You can spend the whole morning. It's exactly it's the same. Many people say, well, I'm just going to the ER. The ER is for emergency. It's not for your cold or your upset stomach or things like that. You're supposed to go to the ER because you cut a finger or you were in a car crash or you have a heart attack maybe. But for some small things, many people go there and it gets crazy. So this is kind of vicious circle that never ends and doesn't help at all. That's the thing. Um, there's a lot of people, like I said, they try to provide the service and enrich everybody, and it's wonderful. But there's still a lot of work to do. There's still a lot of work to do to reach people in low income, to reach minorities. So there's a lot of work that we have to do. And I say we because we live here, so we have to support the health services and things like that in one way or another.
Yeah, definitely. I agree with what you're saying in that I think any solution with moving forward has to come with community support as well. And I think you've identified some of the most important issues involved there. Another thing that definitely impacts how care is provided is things like racism and implicit bias on behalf of the healthcare providers. What are some specific biases that you think are present in the Latino community or in the Hispanic community in Memphis? And how does that affect the care that they get?
Okay, I think that more than anything, I'm gonna go back to the language. Sometimes the people don't want to provide the service because of the language. They think, now they're not gonna understand. I used to be on sales and visit doctor office and say, well, you're in an area where you have a large Latino community. You don't want to reach it. Well, we don't have anybody who speaks Spanish. I don't speak. Yeah, but you still have the people, if they have the need, they will find a way. They will bring a translator or most of the people speak their language. So sometimes that is the excuse not to reach them or not to provide the service. To say, well, we don't speak Spanish. Well, you don't have to speak Chinese to serve people from China or Vietnamese. Imagine if all the doctors have to speak every language to serve every community. It's just ridiculous. I think that's one of the main things. And say, well, we don't speak the language, but we can provide the service. That's something that people might use just not to reach them. That's the way I see it. I don't want you to think that everybody do that, but that's the way I see it. You don't want to provide the service to certain community. You can say, well, doesn't work. A lot of people, especially Latino children who are born here, they already have taken care, so you don't have to be worried. Of course, the mom might have probably trouble speaking the language, but they still. So it's just, I think that's mainly the thing with sometimes not getting the service. Um, we have a lot of clinics now that are specifically focused on the Latino community. They take care of everybody, but we have a couple of clinics with the doctors who speak the language, and there have so many patients that sometimes that they can serve to everybody. So we need a little bit more service. And let me tell you, I think as a Latinos, we used to go to the doctor and talk to the doctor for hours and explain. They know our lives. They even know our mothers or grandmothers because everybody see him. It's like it's really a family doctor. And here you go to the doctor, and one day you have to be seen by the nurse practitioner. Next day to see one doctor or a different doctor. So you don't have that relationship. You don't have that connection, and it's like who is my real provider? That's the thing. So it's just different. You adjust, but it takes a while. And people who just got here is like, this is not like in my country. No, it's not. It's totally different. So we had to
Yeah,
just
definitely.
adjust.
Sounds like it. Actually, there's you know, I'm involved in or I'm the president of a group called the Medical Spanish Forum at the University of Tennessee. So we try to provide sort of a space for students to practice their Spanish and learn medical Spanish in particular, so that we can communicate with patients effectively. So, you know, hopefully in the future that will lead to more providers, more doctors who speak Spanish and feel comfortable doing so. But
And let me tell you something also, even not just the doctors, also the people around even from the front desk, the people to understand that we are, this Memphis, let's talk about just Memphis, it's a melting pot with people from different countries. So you have to be open. I'm going to talk about Casa Teatro. When people say, I want to be part of Casa Teatro, we have just we request two things. One, to be respectful, because everybody's different. Everybody has different ideas. You don't have to agree, but you have to be respectful. And the second, to be open to learn about a new culture and about a new community. And I think many times with the people that works there and the medical field, sometimes they don't know that they have to be open and welcome everybody and learn about the other people. We're all different, but in one point we have something similar that's going to unite us. We might have something they say, well, we're not that different. We suffer the same thing, or we have this situation that unite us. So let's look for that. I think when there has to be also a process and with the service and a doctor office from everybody, not just the doctors, the nurses, the front desk person, the managers. Say, we're gonna welcome everybody. We're gonna have people who is black, white, yellow, blue, green here coming. So everybody has to be open. So they have to be able to say, yes, we are here to provide a service to everybody, to everyone. Because if you're expecting just one kind of people, your world is gonna be this small like this right now. If you say we'll welcome everybody, it's gonna be like this. You can't hold it anymore. So that's my point of view.
yeah, ¿cree usted that every medical provider should, like, as part of their training, learn about implicit bias and learn about?
Es importante. Oh, sí. And I believe that is important for anybody, for any kind of service, to learn about that. Many people miss that part. You're a great doctor. Yes, you can take a heart and change it for a new one. but you have to learn a lot of things. How you treat your patient, cómo les hablas, what way you get close to them. So that's the thing with we not just to learn how to be a doctor, have to be also an open person for everyone, for all communities who are gonna come to you office. And the people in your office have to learn that too. So there is a need, and we have to do it. We have people who comes to Casa Teatro to just to practice their Spanish. After a while, they always say, well, I'm so happy that I did this because I'm still learning a little bit about the people from Venezuela, how different are from the people from Colombia or the people from Mexico. Of course, the words that we don't say to each other because it has different meanings. And I think that's sometimes something that the people in the medical field has to do. Learn that everybody might look the same to you, but they're different. They have different things. You have to learn. You have to open mind and open heart to and learn. Appreciate the other community. These people needs me because that's the truth. We need the service. We need the medical providers. Now I'm not just gonna cure that cough or that tummy ache and make the community strong because I want to come back and bring the mother, the grandmother, and the kids, and I want everybody here so they know that I support the community and I want to be part of that. I think that's the problem sometimes that we see separated. We're the Memphis community. That's something that sometimes we forget. We are in one place and we share the same place. So we are one community and we should be talking that way.
Yeah, definitely. I agree with that. So this is kind of a personal question, and you don't have to feel obligated to answer it, but have you personally experienced racism or any other discrimination in your healthcare interactions? And if you feel comfortable describing that and how it made you feel and maybe how it could be avoided.
I did it a long time ago. I did it when I have my first baby. I had that was like 23 years ago. My English wasn't that good. I speak. One of the things with Latin American women is we don't change our last names like the American women's. We keep our father and mother last name. And I always been Monica Sanchez. All my life I've been Monica Sanchez. That wasn't the last name of my husband. So when I signed to the hospital, I signed as a Monica Sanchez. And I put all the information. The problem is that people thought that Sanchez was my married name. And when they did the paperwork for my daughter when she born, they put her Monica Sanchez, but her name's supposed to be Monica Flores because that was her father's last name. When I tried to explain to the lady that that was wrong, that if she could change, because she was filling that form, she said, well, you just have to do it on the Social Security office. And she left and left me there. And I was like, that I knew that wasn't wrong and that wasn't the answer that I want, but I feel just frustrated because I wasn't able to defend myself and say, look, lady, that's not the way it is. And that's not the last name, but that was actually the last time. That is something else that happened to me a long time ago, made me say, I have to learn English. I had to be able to fight this kind of stuff because I can't relate to anybody. I was alone at that moment. And I didn't knew how to react to the way this lady was being rude and and I just didn't know how to handle the situation. And I think a lot of people feel the same way. Um, Sometimes I say to people, please forget about saying yes, because a lot of people, when they come here, they always say yes. I say, don't say yes, because maybe they asking you something else and you're saying yes. No, say maybe, learn the word maybe, because that's something that is wrong. But that was the only time that I feel so bad and with a medical provider well, she wasn't the medical provider, she was part of the office filling that information, but I was at the hospital. So I feel like this person doesn't want to understand me. This person doesn't want to really reach me. She just wants to do this form or paperwork, whatever she has to do, and go away. And maybe it was Friday and she just wants to go home or something. I want to excuse her. But I think the same way that happened to me happened to a lot of people, a lot of women. Why? Because our English is so limited sometimes. We don't know how to explain. I try to explain her, but now my older daughter has exactly the same name that I have. It's also Monica Sanchez. And sometimes it's confused when they call home or when they send email. It's yours, it's mine, who it is. So of course she got the chance to change it, but she doesn't want to change it anymore because she's been Monica Sanchez all her life. So she doesn't want to change it. But that's one of the little details that sometimes make stay in your mind forever. It doesn't matter how good the doctor, because I had a really wonderful doctor who was really kind. She speaks Spanish. She was really nice. And even the nurses, when I wasn't able to talk, they were kind. But this one person make my experience really made me feel so bad. Made me feel so bad just because I couldn't explain her. But after that, say inglés, aprendamos inglés y nos defendemos. Es lo único.
Qué bueno, entonces, yeah, that story actually, I think, also helps illustrate your earlier point, which is that even if you have a Spanish-speaking physician and Spanish-speaking staff, you know, if everyone in the room isn't, you know, able to sort of understand those cultural differences, you can still have some sort of unwanted outcomes as a result.
Exactly.
So
Exactly.
I do think that's an important lesson for us in the healthcare field, definitely.
Exactly.
So my next question is, you know, one of the terms that sometimes you hear is reverse racism. So people say if you prioritize health outcomes for minority populations, then somehow you're discriminating against majority populations. So what would your response to that be?
That's not real. That's not real. I think that is wrong. I think that the people might feel bad because they're being always be number one, and when somebody goes and look at the other side and say, "Oh, well, have to take care of these people too. They deserve." It's like, why? I've been always number one, and now you're taking care of that people. Why? So it's still in your mind. And I go back to the open minds. There's people, they don't have open minds. They have their clamps. They don't want nothing to change. They don't want to see the pain on the other community, say, yeah, they deserve to be taken care of it. And it's just people who doesn't understand how hard it is for the other people to be seen and take care of it, because you always been taken care of all the time. You always been taken care of in one way or another. But when in a moment say, just stay here, don't go, I'm gonna check in this, is when the people say, what? How dare you to take care of that person before me? You're being racist to me. That's not real. I'm sorry. But that's not, you can even go to see another doctor, but that doesn't mean that person is not caring about you. They still caring about you. The only thing is what happened now is that they see that this group of people needs also to be taken care. They also need the service. So we're not going to spend 24 hours with you. We're going to spend 20 and we're going to spend 4 with them. So please stop whining. No, don't cry. I think that's the problem. More than anything is the people who is not open mind and understand that everybody deserves the equal service, the same service. It's just that.
Yeah, and I think thinking back to some of the things that you had mentioned before, you said, you know, everybody in Memphis is part of the Memphis community, right? And so sometimes we talk about, okay, we're going to talk about the Latino community, we're going to talk about like the Black community, white community,
Sí.
whatever it is. But I think it is also really important to think of it and say we're all a part of the same community, you know, and I think that's a great way of thinking about it as well, in terms of saying, you know, no, everybody gets access, everybody can be here and deserves quality healthcare.
Exactly.
So
let me tell you something that I always say, and maybe that's why people is getting out of their comfort zone. Memphis used to be, I do this comparison. Memphis used to be a panda a long time ago, a panda, but now it's a peacock. It's a wonderful and beautiful peacock with different cultures that we have to embrace. And that make Memphis more beautiful. Even Shelby County start changing. So that's the part that everybody has to be open and see that everybody needs to have the same care. Everybody deserve, not they have to, everybody deserve to have the same care, the same health care. So it's the people have to understand how things are changing and how beautiful the community is turning, and the diversity. Not just talking about the Latino community, we're a lot of Latinos. There are more than 56,000 Latinos just in the Memphis area. But there is a lot of people from other cultures, a lot of people from Asia. So let's just change that main way to think. Let's just be open. Really, we have to be open.
yeah, I agree. Well, thank you so much again for agreeing to the interview. Is there anything else you'd want to add in? And then I'll go ahead and stop the recording after that.
More than anything, like I repeat this many times, try to reach all the communities. Be open and embrace the beautiful changes that are happening in our community here in Memphis. I have 25 years living here, and I've seen all those changes, all those communities coming and doing things and needing your service. So just be open, really be open. And if you want to practice your Spanish, come to Casa Teatro, have fun, and learn about people from different Latino countries like Puerto Rico, Mexico, Colombia, Argentina, Venezuela. And that way you will understand how different and how much in common we have, so we can help each other and we can be stronger as a community, please. Open minds.
Buenísimas palabras. Muchísimas gracias por hablar conmigo hoy.
Gracias a ti, Connor. Muchísimas gracias por invitarme. Es funny. Sé que tengo unas ideas muy locas, ¿verdad? Ojalá la gente diga. Claro. Pero gracias, muchas gracias por interesarte en la comunidad hispana. Gracias.